Good morning, Mr. Chair and Commissioners. As Cheryl's handing some of the regular data that we provide around, we'll wait till you get those forms, and then we can talk about that. I also, the other page is also kind of up to date through the end of May, our public health expenses just for COVID response. So you have that form as well. So you can see from the first page of our cases. So right now we have 591. The cases, have not dropped, but they aren't moving up drastically as we are witnessing across the nation with some of the southern states who are really getting to be hot spots. So thankfully we are not that yet. We have 507 that are out of isolation, or in other words have recovered and are back to their normal activities. We went up 1 death, so we now are at 38 deaths. And so in the cases, the active cases now, it was 47 previously. We've dropped now to 20. Now some of these numbers are fluid depending on when Minnesota Department of Health gets them inputted into a system called REDCap. So they're not always, they may change week to week. So they adjust the number of cases. But it's, we're doing quite well still here in Clay County in comparison again to the other states. And so there's certainly a concern as we look at what's happening with hospitalizations, those that are in ICU in the hospitals in some of those hot spots in Florida, California, Arizona. The hospitals are really ramping up with cases in ICU, those on ventilators. So it's pretty concerning. The numbers, age group, is reducing. So we're seeing a lot younger group that are positive and becoming infected. So the median age did go down. And so we're noticing more of that. They're attributing that to, certainly the COVID fatigue that the infectious disease docs talk about. It's just the being tired of dealing with COVID and all of the things that go along with that. People are tired of wearing masks. They're tired of social distancing. So we're seeing a large group of, as you noticed on the news, there's just large groups of younger folks that are gathering together. They're not wearing masks, they're not social distancing, so it's not unexpected that we would see a ramp up in those younger cases. Now those are the cases that aren't necessarily ending up in ICU or on ventilators, because typically there's outlying cases that they become very ill, but for the most part, the younger groups, especially with no coexisting medical conditions, are really being able to deal with COVID without hospitalization. They're able to get through the disease. So that's the good thing about the younger group and no coexisting conditions. So far, and Minnesota is still going up a bit as well. And you can look at the last graph. We added, so the age categories. We've always had that 30 to 39 that's been high in Clay County, but we changed a grouping from the 18 to 22. So you can see actually in that age group that's up there as well. And then the 23 to 29. So, it's not changed much, but we're seeing more in the 18 to 22. So we've handled the long-term care facilities with the elderly pretty well with all the testing and with all the other preventative measures. So we're seeing less situations in those long-term care facilities and congregate care facilities. So, that's good because they are the ones that are at more risk. Our hospitalizations, at least at Sanford and Essentia, still are the same as I have described before, where we're not seeing overwhelming numbers in ICU and in the hospitalizations. So that's good. The numbers, at least in Cass and Clay counties that Sanford and Essentia are serving, we're not seeing an overwhelming number in those hospitalizations. We're hoping to maintain that and keep that going as well. Any questions on the data? And then Cheryl can talk a little bit about working with colleges.
I think we're set. Go ahead, Cheryl.
Okay.
Good morning.
So a couple of weeks ago, Minnesota Department of Health put out some guidance for higher education. And I made a point of contacting our higher ed facilities to ensure that they have received that. And since that time, I've had a couple of Zoom meetings with MSUM and also with Concordia, just assisting them because, of course, this type of planning for this fall with students coming back to campus is actually a bit overwhelming for them, because when you have students living in the dormitories, and we do have a fairly large percentage of international students that will be coming back. Now, some of those students were never able to get back home after their semester, in spring semester, so they still have some students that have been living on campus during this entire time. But for the new ones that are coming in, they're looking at the possibility of quarantining those students that are coming internationally initially to make sure that they're not bringing the virus back in with them, depending, because they come from many, many different countries. And then also just looking at how they can potentially, if they have a student that becomes ill on campus, how can they isolate or quarantine that student or those students for their duration that they need to be isolated or quarantined. Also looking at, they both are establishing medical providers for their facilities, so if they have either faculty or students that need to be tested, that they can do that pretty quickly without having to call and schedule appointments and then try to figure out transportation for students to get over there to be tested. So it's going very well, and we really appreciate that they have asked for our input as well. So we're basically serving as a resource for them from the materials that we gather between Center for Disease Control and Minnesota Department of Health. Any questions?
Do we have any idea of the numbers that come from other countries?
I don't have exact numbers for you.
Okay. I mean, to quarantine, it'd be interesting to know how many,
right,
what kind of space you're going to need for that.
Right. Yeah, that's where they're really struggling with. Both MSUM and Concordia are looking at taking a couple of floors within their dorms to be able to house some students where, and they're looking at it that if we have a student that lives in the region, basically, from either of those colleges, that they potentially, the best case scenario would be if they could just go home if they need to isolate or quarantine versus try to stay on campus.
And we'll continue to meet with those campuses. There's someone assigned from Minnesota Department of Health to work with the higher ed, and that individual is coming to our community next week. So Cheryl has been asked by Concordia at least to meet with them as well. So they'll be meeting with them to discuss their further planning. Some of the complications that we might run into is we're part of that Red River Valley Task Force, and North Dakota is really looking at testing all students when they come back. So that would be for NDSU and other North Dakota campuses. Minnesota Department of Health is stating that they don't feel that's a great source, good resource. It'd be a lot of work and a lot of money invested, and it's a point prevalence test, so it'll tell you just that day whether they're positive or not. Now, you might catch a few positives initially and then avoid some spread, but over time, anyone could be positive even a day or two later. So they don't feel there's value to that. We were asked by one of the campuses to do testing of their students when they come back. So there's going to be more discussion in regards to that. But at this point, MDH is saying, no, we're not going to be testing the higher ed students. So we'll see how we have another meeting this week with the Red River Valley Task Force. So we'll be discussing that further between, it's complicated between Clay and Cass because they want us to stay in step. And so as students transfer back and forth. So
right.
We'll see how that
You're
works
commingling
out.
all the time.
It puts us in the position as usual being on the border, because on one of the calls late last week, they said there's between 800,000 and 900,000 students in the state of Minnesota, and if they were to test one, for instance, if they were to test one here in Clay County, then they'd have to test everyone in the state of Minnesota. So.
Yeah, I think it's a difficult situation for these colleges to,
Yes,
which way to go on that.
right.
Because if they have one student or two students that gets infected, that pretty much takes the whole.
Yeah, we could see a mass uptick of that, so that's concerning for the fall.
Okay.
Any questions on the, we just, I gave you the, kind of the expenses so far, and again, it goes through the 20th of May, although it doesn't include the last payroll in May, but as you can see at the bottom, we did have, or actually at the top, the Department of Human Services grant, so we had that for the hotel. So we were able to use, almost 6,000 out of that grant for that, that mission. And then we had an Otto Bremer grant as well that provided just a few supplies. So we were able to use the funding, $318 out of that. So that's been helpful. So total that weren't covered by the grant is $147,743. Still a large number, but that's from the beginning when we started, actually back in February through May.
Mr. Chair?
Yes, go ahead.
Thank you. So the 98,000 that is covered by the grant, that's through the public health grant, right? from the
Oh, and
state?
I'm sorry, we did have, thank you for bringing that up. We had some funding through Minnesota Department of Health that came to our Community Health Board, which is our 4 counties. And so we received that 98,000 out of that, sum of money. So those were all for COVID expenses as well. You're
And then
right.
maybe a question for Steve. Based on Kathy's report here, the dollars that are showing, the 147, that's not covered under what she's been able to do now, that should all be covered under the CARES Act, wouldn't it?
We would need to look into that, but yeah, there'd be a very good chance that would be covered in addition to some of their salaries.
I talked to Gabe last week, and he thought maybe some of even the regular expenses, particularly for public health, because that's all that we were doing the last 3 months at least, it potentially could be covered as well. So more to come on that. We'll see what FEMA decides about that. We're keeping track. Of course, we have a separate code keeping track of all those expenses, regular and overtime expenses.
Okay. Any other questions?
Well, I think it's promising to see that our active cases are down to 20. We haven't been there since April. So we'll just continue the due diligence and hope to see that number decrease. But I think to go to what the total COVID expense, 246,000, I think for the public to know that with 591 positive cases, that's over $400 per case. And so it's expensive in dealing with that, both even with the grant, it's still expensive.
Mm-hmm.
Those active cases that Commissioner Mosher talked about, it'd be, where are we in doing testing in comparison? If you're not doing any testing, you're gonna have any new cases.
Right.
So I'm assuming there's still some testing going on.
There are testing sites on the Fargo side. I think we talked about it a couple weeks ago, the static sites. And so those were for all the long-term care staff, correct, Cheryl?
Healthcare workers and
Yeah.
then some businesses as well. So as businesses started to reopen, if they felt like they had a group of employees that needed to be tested, they could certainly, and we sent out information on that through the chamber to let businesses know that testing opportunity was available.
I guess my point is the numbers look really good right now. I just don't think, at the same point, when the people see that, they shouldn't just
Become complacent.
so
yes.
comfortable that this thing isn't around anymore.
That's right.
If we're not doing any testing, we're not seeing any new active cases.
Right. And we anticipate, obviously, we're not done with COVID.
Yeah,
That's
well,
going to continue.
That might go on forever.
It might, right. And hopefully we'll get a vaccine in 2021. So that will help with herd immunity. So
Right. Okay.
So as an individual, if they want to get tested, Do they go to these sites, or they go to the clinics, or?
Usually if they have a question, and I have gotten several calls in the last few days, asking where people can become tested at, and usually I ask them if they have a medical home and recommend that they go through their provider. Both Essentia and Sanford, you can call their nurse line. With Essentia, they prefer to set up an electronic visit with the individual and then determine whether or not they be tested. And with Sanford, you call the nurse line, that person does a screening with you, and then they will basically determine or refer you to a medical provider for testing.
Okay, thank you.
And then Family Healthcare also does testing for their patients, and they also have done the vulnerable populations as well, homeless individuals. So they do testing at their facility.
Good information. All right, thank you.
Thank you.